How many PRP sessions do you need for hair regrowth? PRP for hair restoration isn't a one-time solution. It's a process that takes several treatments to deliver noticeable, lasting results. Typically, most patients will require a series of 3 to 4 sessions spaced 4 to 6 weeks apart. During these sessions, the PRP is injected into areas of the scalp experiencing hair thinning, where the concentrated platelets and growth factors stimulate hair follicle regeneration and improve circulation. The reason multiple sessions are necessary is because hair growth is a slow process. The healing and rejuvenating effects of PRP take time to work as they encourage follicles to enter the active growth phase. Most patients will begin to notice thicker hair and reduced shedding within 3 to 6 months after their initial treatments. However, the full effects of PRP may not be visible until 12 months after the first session, as hair takes time to grow and thicken. After the initial set of treatments, many patients opt for maintenance sessions every 4 to 6 months to preserve the results. These follow-up sessions help to keep the follicles stimulated and prevent future thinning or hair loss. The frequency of these sessions depends on the individual's progress, but regular maintenance is often essential to maintain the regrowth and volume achieved. It's important to remember that PRP works best for people in the early to moderate stages of hair loss. Those with advanced baldness or complete hair loss in certain areas may see limited results, as PRP is most effective at revitalizing dormant or thinning follicles rather than growing entirely new hair in areas where hair has long been absent.